All right. Hi, everybody. We've got a few folks joining in here. I'm Dr. Jennifer Curtin. I'm the Chief Medical Officer and co-founder at Rhythm, and I'm actually going to be filling in for Dr. Stuart Malcolm today. All right. I'm going to wait a little bit longer to let a few more people come in. I know we had about, I think 25 people or so RSVP for this, so I'll wait until we've got a few more folks in before I start. All right, good. We got quite a few people joining in. And for those of you just joining, I'm Jennifer Curtin. I'm the co-founder and Chief Medical Officer at Rhythm. I'll be filling in and doing this talk for Dr. Stuart Malcolm today. All right, great. So I'm going to share my screen, get my slides up here. All righty. Hopefully let's see. Okay, guys, so it looks like we've got quite a few more people joining. All right, so I'm filling in for Dr. Stuart Malcolm today. I'm Dr. Jennifer Curtin, for those of you who've joined a little bit later. All righty, so I'm going to jump in. Today we're talking about how to prevent COVID infection or reinfection in a world that doesn't really understand long COVID. And it seems like the world's really trying to move on from COVID and kind of minimizing how much of a risk this still is. So we're going through this presentation together to see what are the things you can do to try and protect yourself. All right, so today we're going to be covering things like masks, eye protection, air purifiers. I'm briefly going to go over carbon dioxide monitors, but to go more in depth on that, I can do another talk on it another time. Nasal sprays that you can use to try and reduce risk, medications and supplements. I'm not going to be going over the standard stuff like hand washing, avoiding touching your face, etc. In this talk, but those are still very important. All right, so the first section is masks and respirators. So first thing I'm going to go through is the rating system. So what do the numbers and the letters mean when you hear an N95? Like what does the N mean? What does the 95 mean? And then I'll be going through the different masks by rating from most protective to least protective, and then give some examples of each type of mask. And then also talk a little bit about the importance of making sure your mask fits you well and some potential links on guides for how to make sure your mask is fitting you well. Okay, so what are the different mask filter classes? So what does the letter mean? And you may have seen there are masks where the main letters you'd see in front of them, so like an N95, you might see an R99 or a P100. So the letters P means the filter is oil proof. R means it's oil resistant, and N filters are not resistant to oil at all. So what does it mean to be oil proof or oil resistant? So let's say you are, I don't know if you guys have ever like worn an N95 mask and you walked by someone eating like McDonald's or some kind of greasy food and you could still smell it through the mask. It's because the N series masks don't filter out particulates that are carried in little tiny oil droplets. And so the P filters, those are oil proof, and the R filters are oil resistant. What does the number mean? So when you say P100, the 100 means that that mask, it filters out 99.97% of airborne particles. An N99 mask means that it filters out 99% of airborne particles. And an N95 means it filters out at least 95% of airborne particles. So that refers to how good is the filtering ability of that particular mask or filter or respirator. So the higher the number, the more things it filters out. So now going into face masks, wearing any mask is better than no mask at all. And don't let other people tell you otherwise. I mean, in the hospitals, when we go into a room where someone has something like tuberculosis that we know is aerosolized, we have to be fitted with a mask, wear face coverings, wear the N95 mask with straps behind the head, full gown, and like hairnet and everything. So, you know, and they have negative pressure rooms. So they do make a difference. They're obviously used in infectious disease settings. So, you know, there are people out there who, you know, may look at you funny for wearing a mask. Don't let it get to you. They do work. And so I'm going to list several mask ratings from the highest filtration to the lowest. So a P100 or equivalent is going to be pretty strong protection. So this is going to filter out water-based particles and oil at 99.97%. Below that is, I didn't put in N99, but an N99 mask would be in between an N95 and a P100. So N95s, which are the ones we kind of hear about a lot, these filter out 95% of airborne particles, and they don't filter oil-based particles. KN95s, these also filter out 95%. KN95 means it's approved by the Chinese equivalent of the US approval board for masks. There are quite a few counterfeit KN95s. The CDC tested a lot of them early on in the pandemic, and many of them actually failed the testing. So you just have to be careful with which brands of these that you buy. We'll have some examples of good ones. A KF94 filters 94%, and this is approved by the Korean equivalent of NIOSH. Surgical masks, they're not ideal for COVID-19 protection because they don't really protect against like airborne aerosols. They protect more against droplets. There are different kinds of surgical masks. So there are some that are rated that have an actual rating to them. ASTM level 2 or 3 surgical masks are better than cloth or non-certified masks. These help mostly for larger droplets, but the mask has to be well fitted to your face. Cloth masks, again, not ideal, but better than nothing. Again, more for larger droplets if well fitted. Some examples of P100 respirators. So on the left here with these kind of pink pancake filters is the 3M 6000 series. It's a P100 half face respirator. It has behind the head straps and it has an exhale valve. This one's pretty intense for walking around, but this one is great also for just like, you know, if you have mold issues and sensitivities or you've got mold in your bathroom and you're remediating, this is a great mask for that. The exhale valve allows less moisture to build up inside of the mask as you're breathing through it. This one is reusable, and the filters last about 3 to 6 months depending on use, and you can swap them out and they're fairly inexpensive. On the right is the Spirion P100 disposable respirator. This one looks a lot more like kind of an N95 mask that you might be used to seeing. It does have an exhale valve on it. This one is like available at Home Depot and on Amazon. 3M also makes more of a kind of a mask looking version of this as well. And then for some N95 respirators, these are NIOSH approved, meaning the US board that certifies these and tests them. The Gerson N95 3230, it's the duckbill one, so kind of when you wear it, it sticks out like a duckbill. This one's a good one, highly rated. The 3M Aura 9205 has behind the head straps, it's a trifold mask. It's the one in the middle. And this one's also very good. And then the BLOX surgical N95 respirator, it's also a duckbill. And this one's actually really cheap. It's on sale right now at BLOX's BLOX Direct. And this site here, Ambrust USA, they're a mask maker based in the US, and they have a really good directory of masks that they've tested using their NIOSH equivalent equipment. And so if there's any masks that you have and you want to look up if they're good, you can go to their site and actually look through their directory. There are some N95 roughly equivalent masks. They're not yet NIOSH approved, but they have data on their filtration effectiveness. And some of them are actually going through the process of NIOSH certification currently. They just haven't obtained it yet. So the one on the left is called Ergomi. And this one, you know, it's kind of a pun on the fact that they use a folded filter design. And so this folded filter design, it improves the breathability. So because there's a lot more surface area contacting the air that you breathe out, it doesn't tend to impede airflow when you exhale as much as some of the other masks. So it can be a bit more comfortable if you tend to feel kind of suffocated by masks. This one did pass lab testing with Nelson Labs, which is another very large and pretty well accredited testing lab in the US for masks. This mask on the right is the Cambridge mask. This one's actually kind of closer by the statistics they have on their testing is actually closer to like an N95 mask. This one is about $10. You can order it in the US. It's reusable. It does have an exhale valve. They used to have stickers that you could buy to put over the exhale valve. I don't know, at one point they sold out, but maybe they've gotten them back in stock. And this one has an adjustable chin strap underneath that you can tighten to improve the fit. For Kn95 masks, there's several here. And here are some good examples of these. So the Flo Mask, which is being worn here, so this one's reusable, and you basically can take the mask apart and swap out just the filter on the front. So you can reuse the actual mask and clean it many, many times. It is more expensive up front. I think it's around $89, but then the filters are pretty cheap to swap out. This one is certified Kn95 for the adult masks. The children's masks are not yet certified. There's another brand called Powecom. This is available on Amazon. This one on the Ambrose USA actually passed the certification testing that they did on it. And then also, this is one that I've personally used. And I feel like the ones in white seem to fit better than the ones in like burgundy or some of the other colors that came in. So I'd recommend if you get the ear loop one, get the white one. I've tried all of them and the white ones just seem to fit better for whatever reason. Another brand is the Ambrose Kn95 mask. This one is made in the US and passes the fit testing. So then talking about fitting the mask to your face. If you have an amazing mask, like the filter's wonderful, but air is leaking in all around the side of it, either at rest or when you're moving your head, then that mask is going to be much less effective because air that's unfiltered is getting in and you're breathing it in. So there are formal fit testing procedures that they do like in hospitals and healthcare settings where they actually have you put your mask on and they put you in this kind of like a hood and they nebulize some kind of really nasty, bitter tasting solution in there. And they have you move your head up and down, left and right, side to side, and see if you can taste that nasty, bitter stuff in your mouth through the mask. And if you can, it means it's not fitted well to your face. And so what they do then is they have you go back and either get a different size mask or they adjust the fit, like the nose bridge and where the straps are on your head and everything, and retest it until you find one that's got a really good fit for you. Because that's the only point where the mask is safe to wear into a room where there's aerosol infection. The US Army actually has a guide that is available for mask fitting in the field, meaning if during like a high demand scenario like a pandemic, if you can't get a certified mask or you can't get one that was pre-fit, how can you actually do the testing yourself? And they've got a good guide for that. And there's a YouTuber called Newstrom who actually walked through his own process of following that guide and doing fit testing on his own mask. The stuff he bought, it cost about $60. The video is long, but it is time-stamped. And so we'll be sharing this link in Mighty Networks after, and it can walk you through. And we'll have some links as well to just a formal fit testing kit that you can buy that's got all the same kind of equipment that you would use in a healthcare setting to formally fit test a mask too. It's just that's a more expensive option. You're looking at probably close to $300 for that kit, but it can be used for many, many, many mask fit tests. The other thing that's a possibility is if your mask is not really sealing that well to your face, particularly if you're using more of like a surgical mask or a cloth mask, there are these external straps that can, or mask braces that can fit over the mask and they can kind of seal it to your face better so that you get a better fit. There's one called Fix the Mask, picture to the right. There are several others as well. So the mask fit is really critical in making sure that the mask is working properly for you. So next I'm going to go into eye protection. We're going to talk a little bit about study data pretty briefly, and then just some different examples of eye protection you can use. So there are several studies, including this one, that have shown that people who wear glasses actually had lower COVID-19 infection rates. And so this has been seen in a couple different studies. The one to the right is just one example. And so essentially eye protection, it's not a replacement for wearing a mask. Definitely the mask is number one. Eye protection can be added additionally in areas where, let's say, there's really high community transmission, you're in a very high risk area, it's crowded indoors, poorly ventilated, or let's say you're in an area where there's a lot of people who may be infected, like you're waiting in a doctor's office lobby that's crowded, or you're going to like the emergency room, or you're going to a waiting room in a hospital setting. Some examples are just glasses, just regular old glasses. The studies have shown that those do actually reduce the risk somewhat. There are glasses that have splash guards. So they're designed to protect your eyes from like things that may splash, but they've got, basically they seal the gaps on the sides of the glasses, the top and the bottom. And it's not a perfect seal. It's not going to keep out airflow or anything like that, but it will help protect against some droplets that may try to come in from the side. There's also face shields. Face shields, cheap and available. Obviously, you're still getting airflow, and this would not be something that replaces a mask by any means. It would just be something that you might wear over a mask that you have on. Generally speaking, you want to get one that doesn't have a gap between the visor and your forehead, one that kind of wraps further around your ears, and one that goes below the chin, unless you've got a really, really good mask. And then let's say you're going into somewhere where you're, let's say, on a very, very crowded subway train, and there's people coughing around you and things like that. So that's like a really high exposure area. You might want something that seals around your eyes. So something that would keep out air from getting into your eyes. And this is something where you can use something like swim goggles or certain types of safety goggles that are designed for keeping out caustic liquids to the eyes. So one example, I actually bought these myself during the pandemic, is the Roka X1. These are swim goggles. They cost about $27. They have a larger area of view. So a lot of swim goggles have a very tiny spot that you can see out of. These have a much larger one, which is why they were kind of going around in some of the pandemic circles for a while. There are also other safety goggles and other swim goggles that can be used too. And I'm briefly going to just touch on CO2 monitors and kind of why you might use one, give an example of one. This, if you guys are interested, I can go into more depth on CO2 monitors in a separate talk, but I'll just do a brief run through now. So CO2, basically people exhale a lot of CO2. And so if you can have a monitor that detects how much CO2 is in a room or in a building, and you're noticing that it's going up really high, it may mean that the ventilation in that room or that building is not good enough to keep up with the number of people in the room. And so you can kind of use CO2 as a surrogate marker of how much infectious particles someone who's infected might be exhaling, and how much of that might be just kind of sitting around in the air and not being sucked outside by the building's HVAC system. So you can use a CO2 monitor, take it with you into spaces and see how high is the CO2 in that area. If it's really high, this one over here is the RNet 4. It's very accurate, well rated, costs about $250. There are cheaper units out there. The thing is, it's always a balance between accuracy and cost. One caveat on this one, I actually have it myself, is that it does take a couple minutes to update the reading once you go into a new area. And so you might have to be in there for like 2-3 minutes, maybe 4 minutes before it'll update. But this would be something that might tell you, okay, if you're going somewhere where you might have to take your mask off, like for a dinner or something where, you know, whatnot, ideally you wouldn't have to, but let's say you're also outdoors and it's really crowded. You could also kind of see Is there a lot of CO2 in the area? To see if it's like, I should maybe leave this area or maybe not take my mask off, etc. Okay, and then now I'm going to jump into air purifiers. So really ventilation, really good air quality is key for trying to keep COVID down indoors. And so I'm going to talk about some factors to consider when buying one, some example units for large rooms, small to medium rooms, and then also some personal and portable air purifiers. So there are quite a few things to consider, and this list is not even comprehensive for what to think about when you're buying an air purifier or thinking about buying one. So the filter type, is it a HEPA filter? Is it a kind of a knockoff HEPA filter? Is it a PCOS filter, which uses a photocatalytic reaction to break things down? That's what the molecule uses. I don't think that filter is quite good enough yet per some of the studies out on it. What is the smallest particulate size that it filters? So many HEPA filters go down to 0.3 microns, which is the size of the particle, the smallest particle that it can filter. But there are many, including ones I'll go through, that filter much smaller particle sizes, some even down to the size of some of the smallest viruses that we know of. Also things like filter life. How long is the filter going to last before you have to replace it? Because that's, extra effort, and you might forget, and then the filter's not working that well. So you're running it, but it's not really cleaning the air. And also it adds to cost. So if you have to replace a filter every 6 months, that will add into the cost of the lifetime of the air purifier, and you need to think about that up front. Also, it's important to know what room size the unit's rated for. So certain filters, they test them to see how quickly can they filter all the air in a room within an hour, or also how many times per hour in a smaller room. This is important to know because let's say you have a room that's really high traffic, like a dining room, where people are sitting and they're eating with their masks off and things like that, and they're talking. This room might need a filter, an air purifier that can cycle through all the air in the room several times an hour, rather than just once an hour, to really keep up with all of the particles. The Cater, this is basically a kind of a rating or score of how quickly that particular filter can filter out a specific type of particulate, something like smoke, pollen, pet dander, in a room of a certain size. So generally speaking, the higher the Cater, the faster it can filter out that particular particulate in a room. Noise level is important because many times a lot of these tests that are run with the filter on its highest speed setting, which is usually the loudest setting. So if you're getting that, I would look at the top end of the noise range and say, hey, is this something I could really tolerate or not? Generally, 25 decibels is considered pretty quiet for a filter. Getting up into like 50, 60, 70 is getting up there pretty loud. Because if it's something you're going to be running in your bedroom at night, you want it to be quiet, but still filter. If it's something in your living room or your dining room and you want to be able to hear people talking over it, you don't want it to be so loud that it drowns out people. Cost, factor in the cost of the purifier, but also of the filters. And I misspelled warranty here. Warranty and return policy is important. Let's say you get it and it breaks, or it's too noisy and you want to return it. Certifications and testing, like have they tested it against SARS-CoV-2 or other viruses? That's important. And then reviews and ratings. What have been other people's experience? There are also some kind of extra and unique features that you can consider. So things like carbon filters, they help with odors. UVC, that helps with kind of sanitizing the filter and some of the air going through it. Ionizers, they spew out ions to charge some of the particles in the air so that when those particles flow through, they will stick to charged plates or surfaces within the filter. So it kind of adds to its ability to get smaller particles out. Ozone. Generally, ozone, even though it's a good antimicrobial, it's not good to breathe ozone. So I would avoid filters that put off ozone as a byproduct. So large room air purifiers. So this is something for like 1,000 square foot room or higher. So some of these, the IQ Air, this is generally a good brand. They are kind of expensive. The Health Pro series, these are anywhere from like $799 and up. It filters 99.5% of particles down to 0.003 microns, which that is the smallest I have seen in terms of filter, the ability to filter. The filters in these last quite a bit longer than standard. There are 3 filters in this. So the shortest lived filter lasts 16 months, but there are some models where they have less filters and it lasts 4 years. So you don't really have as many of the filter replacement costs that you do with other units. This has actually been tested on ability to filter viruses and bacteria in the airborne state. And it was chosen by the Hong Kong Hospital Authority for both the SARS-CoV-1 and SARS-CoV-2 outbreaks. Austin Air is also a good one. However, I was reading some reviews on this, and actually I bought one myself, and I had the exact same experience as the reviews. So it's fairly expensive unit. It's very heavy. A lot of people were saying that it arrived dented or had paint on it. Mine had both. It still worked, but it was also quite loud on high. And so really it was so loud, we just couldn't really hear each other talking. And so we ended up returning it. It is a good one for, let's say, a setting where maybe you've got, the noise is not as big of a problem. Small to medium room air purifiers. So the Coway Air Mega is a pretty good one. It's rated for rooms up to 361 square feet. Right now it's on sale, I think, on Amazon for $169, but its standard price is $199. The HEPA filter has to be replaced every year. The deodorizer filter every 6 months. This one has been tested against SARS-CoV-2 and has a pretty good, like 99.98% of removing the virus. It goes down to 0.01 microns, which is pretty darn good. And it also has a pretty high Kder against smoke, dust, and pollen. This unit's fairly small, but it can really move air quite well. The Blue Air 7770i, this one is actually rated for larger rooms. It can clear out all the air in a 674 square foot room in about 12 minutes. It is quite a bit more expensive. It's a true HEPA, 99% filtration, down to a much lower, down to 0.1 microns. And it has a germ shield filter that kills organisms that get caught in the filter. Germ Guardian, this one's probably the least expensive here, but it is a smaller unit that this one goes down to 0.3 microns, and it can circulate air roughly about 5 times an hour in a 153 square foot room. So this one's kind of smaller. This one is actually on sale. They have a $25 off coupon, even from the $94. So it's pretty cheap unit. So you could potentially even just get several of these. And then there's personal air purifiers. So these are ones that are portable. They can be powered by batteries. So you could theoretically take them with you. The IQ Air ATEM Desk, this one is bigger. So this like fits on your desk. It has a special carrying case that's about the size of like a small backpack. It can run 12 hours with a power pack. It's kind of expensive though, $399. It blows the air directly at your face. So it kind of creates like, it puts it right where you need it. And it filters down to 0.03 microns. The LG PuriCare, this is a really tiny portable one. This weighs 1.2 pounds, 8-hour battery life. The filtration is not quite as good, and it doesn't get into specifics about how small the molecules were that I was able to find. This one's about $199, although I think this one is also on sale on Amazon for maybe about like $169 or something. But this one you can kind of fit in your purse, take it with you. So now I'm going to jump into nasal sprays. So nasal sprays, I'm going to start by going through, and also not just nasal sprays, but some of these involve gargling the solution in your throat as well. I'm going to go through the ones with more evidence behind them first, and then go through some of the ones that have weaker or mixed evidence or some notable side effects after that. All right, so colloidal silver. This got kind of a bad rap early in the pandemic because some people were pitching it as like a cure for COVID, which it is not. But there have been studies. So here's a randomized placebo-controlled study in 231 healthcare workers in Mexico. They were using a brand called Argivit. It's not really readily available in the US, and it has a really high concentration of silver particles. they used it as a nasal spray and throat gargle. And basically in the treatment group, the group using colloidal silver, only 2 out of 114 ended up getting COVID during the study period, despite the fact that they were actually exposed to more patients with COVID than the control group. And then in the controls, 33 out of 117 ended up catching COVID. So it's kind of like an 84.8% risk reduction in SARS-CoV-2 infection in the treatment group using the silver versus the placebo group. There are in vitro studies, so in a laboratory or petri dish, that show that just 1 to 10 parts per million of the nanoparticles of silver will deactivate COVID-19. So it is possible that lower concentration solutions may also be effective. Most available brands in the US are somewhere between 10 to 20 parts per million of silver, i.e. Argentin 23, Sovereign Silver, et cetera. We've got some examples of these in the full script protocol that's been shared with all the rhythm patients, and we'll be putting a link to it in Mighty Networks as well so you can find it. There is a possible risk of accumulation of silver particles with excessive and prolonged use. Now, mind you, the study I found that was talking about this, I believe was actually using Argovit, which has a very high concentration of particles. And so it's something where I wouldn't go around drinking gallons of this stuff. It's more so like use it as you kind of need it and just at the levels that they kind of recommend in the study. Another nasal spray is called Nasotrol. This one has been available kind of over the counter. This one was, it contains iota carrageenan, and it's about $20 a bottle at nasotrol.com. There's one study here about 400 healthcare workers, and it may lower the risk of getting COVID by up to 80%. So this was a similar study where they did placebo-controlled, and they had healthcare workers in high-risk settings use this or the placebo, and they looked at how many of them caught COVID in the treatment group versus the non-treatment group. The spray was dosed 4 times a day in the study, so that's what you would likely need to use it at for it to be as effective as the study. Carrageenan can be an irritant to some. Some people are sensitive to it. And also, if it is processed incorrectly in manufacturing, it can actually be toxic, but carrageenan is in a lot of food products and toothpaste and things like that already. So, you know, it's pretty well known that you need to process it correctly. Sanitize. So this is an interesting spray. Basically, NONS is it's a novel nitric oxide releasing component. So it's a liquid, but it releases nitric oxide very slowly from that liquid. And that has the effect of kind of basically having the antiviral effect. So this one has probably been studied the best out of all of them. It's actually approved as like a medical therapy in some countries. And it's not yet approved in the US and Canada, but I believe it's going through trials here in the US. And it is available in many other countries, EU, India, Bahrain, Thailand, Singapore, Israel. And so we have heard of some people have been able to get it online, but it is in trials here in the US. So as far as risk reduction, so there's a study that was done, and basically there's a pretty significant reduction in the number of people who caught COVID in high exposure situations who were using the sanitized nasal spray versus people who were using the placebo. And there was also a randomized control trial. This was done actually in people who already had COVID. They had mild COVID and they used the nasal spray 6 times a day, 2 sprays in each nostril for 7 days. And they basically went PCR negative 4 days earlier than the people who used the placebo, which is pretty significant. It is available in several countries, not quite yet in the US. Now we're going into some of the ones that have weaker evidence behind them for their efficaciousness, and or they may have some side effects that are notable to watch out for. So Covixel, I may not be saying that right. The major component of this is ethyl lauryl arginine hydrochloride. It's a generally regarded as safe ingredient. and it costs about 19 bucks a bottle at Covoxyl.com. This one, the spray, they say is effective for up to 6 hours and can be reapplied every 6 hours or even more frequently in higher exposure situations. The preprint, the major study that I was able to find on this one, though, was a preprint study in hamsters where it prevented infection in hamsters. On their site, they do claim that they did a human study and that 4 times as many people using their product did not catch COVID than those using the placebo, but I was not able to find the study. So I looked all over their site. I did some Googling to try and find it. I couldn't find it. So I'm leaving it in the weaker evidence group for right now until I can find that study. So if any of you happen to find it, please email us and let us know so I can update this. Now this one, I might be butchering the name. Exlier. I'm just going to call it that. I'm probably pronouncing it wrong. This one, so these guys actually got called out by the FDA saying, hey, you're selling this for indications that you don't have evidence for. So then basically some studies started coming out, but most of them are in vitro, meaning in a lab or in a petri dish. And they did show that xylitol does inactivate SARS-CoV-2 virus pretty effectively in a petri dish. And then there was a case series of 3 people with active COVID-19 who used the nasal spray to try and reduce viral load in the nose. And this one comes in multiple forms. So they have the nasal sprays, mouthwash, spray, gum, lozenges, all kinds of things. But the evidence for this one right now is relatively weak. However, xylitol, I mean, it's used in gum and mouthwashes for quite a long time. So this one's like relatively safe. Povidone iodine, this one has kind of like some promising studies behind it. However, human studies had mixed results. And there was one study that had some kind of concerning side effects. Because it has iodine in it, and high doses of iodine can actually kind of like cause hypothyroidism actually. All the patients in this particular study who took this stuff as a nasal spray for 5 days, even though it did reduce the amount of viral load, they had elevations in their thyroid stimulating hormone, even after 5 days of use. It was all of them. So some of them even went into, their TSH went into the hypothyroid range. Now, mind you, there were no changes in their actual thyroid hormone levels, T3 or T4. The levels of TSH returned to normal in about 7 to 10 days. However, that's with 5 days of use. So I'd be concerned if you use this as like a prophylactic thing daily, that you might end up with thyroid issues. So for this one, it's kind of I would probably use other options, and this would be sort of a lower tier option if you didn't have another one. Now, going through a couple of medication supplements and immune support. This area there's really not a whole lot here in terms of what medications and things might be able to prevent you from getting COVID. So this really here, Paxlovid doesn't appear to help prevent infection. There was a study done looking at people who got infected with COVID. They gave Paxlovid to their family members, and then they monitored the family to see how many of them ended up catching COVID. And it did not seem to really reduce the number of people in their families who caught COVID if they took Paxlovid or if they didn't. However, there were some problems with this study. They kind of, it's possible that the way they were testing, some of the people in the family may have already been infected by the time they got the Paxlovid. So, we don't fully know, but generally it's been kind of accepted that Paxlovid doesn't appear to be preventative. It is helpful if you can get it if you catch COVID. It can help lower the risk of long COVID, but it doesn't seem to prevent it. So then that comes to Tolavid. Tolavid is similar to Paxlovid in the sense that it inhibits the 3CL protease. So theoretically, I mean, you wouldn't think that Tolavid would be that preventative for COVID infection if Paxlovid generally isn't. So, depending if you're taking kind of like low doses of Tolavid as prevention, I don't know if that would be really a great idea in the sense that what would be the risk of potentially causing some kind of resistance to develop versus it actually helping to prevent COVID? Immune support. So generally speaking, your immune system is going to be a really helpful thing to prevent against COVID. Now, I know that COVID damages the immune system to a degree. So, it's what can you do to just try and support it in the ways that you can. Help it function to the best that it possibly can, given your situation. Making sure you're not vitamin D deficient and not nutrient deficient is key, because certain deficiencies can lead to the immune system not functioning properly and you having a lower line of defense against virus exposure. Eating fresh fruits and vegetables, having antioxidants, this helps with also making sure there's less nutrient deficiency. But this is if tolerated. I know there's a lot of people with mast cell activation and sensitivities to foods that their diet is super restricted. In that case, making sure you have some kind of vitamin supplementation you tolerate, it's going to be helpful to make sure you don't become deficient in key nutrients. Getting regular and sufficient sleep whenever possible. I know that long COVID does disrupt sleep pretty significantly. So if that's a struggle, trying to find and work with your provider on, okay, what can we do to try and improve the quality of sleep, improve the duration of sleep if you're not able to sleep for very long, and working on that to see if, because the body tends to repair and reset the immune system at night when you're in certain stages of sleep. Reducing stress and pacing, so trying to not get worn down. That'll give the immune system a little bit of a stronger edge in terms of being able to defend you. There are lots of caveats to this. There's a study, a meta-analysis on, does vaccination after a COVID infection reduce your risk of getting COVID again? And a very caveat-heavy analysis did find that roughly about 50% lower chance of reinfection with COVID-19. However, again, a lot of caveats. And for the long COVID folks and the vaccine injured folks, obviously, if you've had a bad response to a vaccine before, this is a big discussion to have with your provider and probably something you may want to avoid and just use other methods of protecting yourself. If you have long COVID, but let's say you've tolerated previous vaccines, that may be a good candidate for continuing with the vaccinations as they roll out. But ultimately, it is an individual discussion with your provider based on your individual situation. There is some data that people with long COVID they tend to have more bad responses to the vaccine than the average population. So this is a discussion to have. All right, so where to find the links to all these items that I talked about? I went through this pretty quickly and there's a lot of stuff we talked about. So rhythm patients, you guys already have access to the list of the nasal sprays and throat gargles in Fullscript. There's a section you can go to that says protocols and you have to click shared with me. And it's called the Rhythm COVID-19 Risk Reduction. If you can't find it, that's okay. We're gonna be posting links to the Fullscript protocol and these items in Mighty Networks very shortly. So please check back in Mighty Networks on Friday and then again on Monday. And we'll also be posting these publicly as well so that other people can use these to help protect themselves in a world that's really not taking COVID seriously anymore. And disclaimer, some of the links are affiliate links, like some of the ones through Fullscript and Amazon, but others are not ones that link to individual brand sites or like YouTube videos and things like that. All right, so that concludes my talk. Everybody stay safe and thank you for coming today. Appreciate the time and attention that you've spent here. Thank you guys. All right, and I'm looking through some questions here in the chat. All right, let's see. So someone mentioned the Flo Mask has some humidity retention problems and irritates the skin. Okay, so that's a good thing to know. So if that's the case, yeah, those of you with like sensitive skin and things like that, probably avoid that one. In that case, the Origami might be a better one in terms of it's got really good breathability. So it's gonna not accumulate as much kind of moisture and CO2 in the actual mask. So that one might be a good one to try. And then Gail asked a question, if the mask has a valve, do you use it or cover it? This really depends on, are you trying to protect yourself or are you trying to protect other people? So the valves actually really help in terms of exhaling some of the moisture in your breath and the CO2 so that it doesn't build up moisture inside and get really kind of wet and soggy. But it allows you to breathe out particles that would then expose other people. So it really depends. If everyone else around you is not wearing a mask, I think it's totally fine to use the exhale valve because, you know, they're all exposed to each other anyway. So really you're wearing the mask to primarily protect yourself. So you can use the exhale valve because, you know, it's really only going to let air out while you exhale. And then it's got a mechanism that when you breathe in, the pressure gradient changes and it plugs that hole. All right, and let's see. And then Britt, what kind of situation would you use one of these nasal sprays? So I would use it, and I do actually use some of them myself. So typically what I'll use it for is I will spray it. Let's say I'm going out and I'm going to be meeting with some friends for lunch outdoors, or I'm going to be going to like a crowded outdoor area, or I might have to go somewhere indoors where, you know, it's like a wedding and, you know, I'm going to have to take my mask off for dinner and then put it back on. What I'll do is I will use it before I go and then after I come back. Now, if it's a very long event, sometimes I'll bring it with me and actually go into the bathroom and spray it and then put my mask back on over it. So, and same thing with the gargle as well. So that's kind of the situation you can use it in. Some of these, you can use them just every day if you're being exposed. And let's say you have kids who are coming back from school and, you know, they're getting exposed to a bunch of things and coming back. So it's something that some of these you can actually use every single day, like they did in the studies, to just help reduce your risk of catching COVID. And use it daily. So either situation can work. It just kind of depends on your level of ambient exposure. And let's see here. Any comment on risk of outdoors for small gatherings? So outdoor risk, you know, there's a lot of factors that go into the risk of an outdoor gathering. How outdoor is it? What's the airflow? Is there like a breeze and pretty good airflow? You're out, you're sitting at a table in a pretty open area, or is it outdoors on a patio with a bunch of tables crammed together and there's like a, you know, something kind of protecting you from the wind? This is something where, you know, you could actually potentially use a CO2 monitor to some degree to see, hey, is the air actually pretty stagnant in this outdoor area or not? And so, you know, depending if there's pretty good airflow, also if you're sitting a little bit further apart from people, like it's a bigger table, then the risk is going to be lower than if you're all kind of crammed around a small table, very, very close to each other, eating next to each other. So it varies a lot by the setup of the outdoor gathering. And let's see here. Okay, and Arete said for the 3M 6000 P100, there's an optional exhale filter to make it safer for others around you too. It makes it heavier to wear though. Okay, no, that's really great. Thank you for sharing that. And let's see. And some people in the still coding groups are talking about buying a Stow-Array Far UVC one for doctor's appointments. What do you think? So the UVC ones, is it for, are these the ones for sterilizing surfaces? Or there's like a ginormous one that is used for air? I don't know enough about the huge one that's designed to sterilize air and how efficacious it is. Because typically UVC, like for the wands, where you're trying to disinfect a surface, you have to hold it like 1 to 2 inches from the surface, and you have to scan at like 1 to 2 feet per, I think it's 1 to 2 feet per second or minute, I can't remember, per second, because the UVC light has to sit on the surface long enough to actually deactivate the virus. So the thing I'm wondering is like, if it's one of those really large ones for air, if the air is flowing past it pretty quickly, I guess I'm just not quite sure. I'd have to like look into that more to know, is it staying in the UVC light long enough for the virus to actually be deactivated before the air just kind of passes by? So, okay, they claim it disinfects within 75 feet of line of sight. Interesting, okay. So I'll have to do some more digging into that one and see. And I'll do some research into that and then get back to you guys in Mighty Networks. And let's see, banana water for dining situations, does it help to hold the breath while taking the mask down to eat a bite of food and then immediately put the mask back on? So this, I don't know if there's like actual studies to back this up, but generally speaking, you know, I was at a wedding that was that we kind of did this, and I mean, I'll be honest, that's what I do. So I kind of just, if I'm taking a bite of food and then I just put the mask back on and chew under the mask. Yeah, so it's a little intense, and it's tough to eat that way. But yeah, it's a challenge. But yeah, thank you for that question. And let's see, I think someone said for a small wearable ionizer, should we look for the same specs as with a mask and larger filters? So I don't know if the stats would be the same for an ionizer that's just an ionizer. So where it's spewing out ions, it's charging them, and then it's sucking them through and presumably getting them to stick to some charged plate within the device. I think things that would probably matter in that sense, and I'm just kind of ad-libbing here a little bit, just trying to think through the process, but this isn't necessarily based on like intense research. Probably how many ions does it release? How fast does it suck the air through? Like how much air can it actually filter versus how many ions can it spew out? Because ultimately, let's say it spews out a bunch of ions, but it's got very, very low airflow. It's not going to really be able to filter all those ionized particles out faster than you can breathe them in, if that kind of makes sense. The other thing too about some of the ionizers is that they need an area to discharge. And so some of them, they discharge through like the neck, like they come on like some kind of little lanyard thing and they hang around your neck. They might you might get a little irritation along where the necklace hits your neck, because that's where it kind of grounds itself almost. And so that can be a little bit irritating. Some of them have like a little different type of ground, but just be aware of that. It might be a little bit irritating to the skin in some areas. All right, let's see. For your very sick patients, are any of them traveling by plane? Do you think there's a way for vulnerable folks to travel safely by public transit, i.e. with mask and nasal sprays? I mean, here's the thing. There are masks that if you wanted to be like really sure, there are ones that actually seal around your entire face, and they've got P100 filters on them, or they have canister filters, like something that seals up almost entirely around there. And then if you travel through an area and then basically get to your destination and then, change your clothes, take a shower, I think theoretically you could travel. I've traveled many times myself via airplane since the pandemic. I have not caught COVID on a flight. I do wear a well-sealed N95. Typically, I wear the 3M Aura trifold mask with the straps behind the head, and I do not take it off from basically taking the Uber or the Lyft to the airport, through the airport, the entire flight, getting through the airport at the destination, getting through the Uber all the way to my destination. I leave that thing on. My face is usually fairly irritated by the time I get back. My rosacea tends to flare up from the masks, but so far I've managed to not catch COVID using that technique. And then also my co-founder, same thing. And it says, what's the risk level around clothing and personal items, i.e. phones? What's the necessity to immediately change clothes and sanitize a backpack and stuff after such travel? So COVID, most of the kind of earlier strains they found actually didn't really seem to be that infectious from surfaces. However, there are some strains that seem to stay alive a bit longer on surfaces more so recently. So I don't know if I would necessarily say that surface contamination is the highest route of infection. I think it is primarily things that you inhale, possibly things that get to your eyes, and then things that you may touch. And one of the key things there is really just keeping things that you may touch. So like I wouldn't touch your phone if it's been like handled and someone sneezed on it. I wouldn't touch that and then touch your face. So you can have little alcohol wipes or use those little UVC phone sanitizers if you want to, and just kind of wipe them down. I tend to bring hand sanitizer with me everywhere, and I just use it before I'm going to eat. I use it, you know, before I'm going to touch my face or adjust my mask or things like that. Or if I've touched something pretty gross, I'll use it. And sometimes I'll just use it on my phone as well. I know that's not the best thing to do to your phone, but I will, if it's, you know, if I've touched it, I will basically just kind of wipe it down quickly. How well do all these precautions you've talked about work to prevent flu? So influenza actually is, so COVID is like droplets and airborne. So it's actually more contagious than influenza by a pretty significant fraction. So influenza, all the things you're doing for COVID, in terms of like masks, air filters, things like that, those are going to work for influenza even better. Flu tends to transmit in larger droplets that don't tend to travel as far, and they don't tend to stay suspended in the air for as long after a person who is infected leaves that room. And so that's actually, it's interesting, you know, they've been looking at all the masking during the pandemic. Influenza rates went down significantly. And it's likely because, you know, the masks work. So in a hospital, when we go into a patient's room who has influenza, we only have to wear the surgical mask, like the blue ones. You don't have to wear the N95 mask that you do when you go into a room where a patient has tuberculosis. And so generally speaking, if COVID is kind of between droplets to airborne, the stuff that works for COVID at the level we're talking about it, like the N95s, well sealed to your face, the air purifiers that can get COVID aerosols out of the air, those are going to work probably quite well on flu. So how long should we avoid someone who has the flu? Okay, so this one, you know, depending, I'm trying to think of, really you want to make sure that, you know, are they still contagious? So have they had a fever in the past? I would give it honestly longer than 24 hours. I'd probably give it 48. And to be safe, you can avoid someone, just give them like a solid 2-week window, possibly a little bit longer, depending on if they're still symptomatic and coughing a lot. But generally speaking, you kind of think of if they had a fever, when does it stop? And otherwise, I would probably just give it like at least a 2-week window, especially for the folks who are more immune compromised. Because depending, if let's say you get the flu and your immune system doesn't work very well, you might not clear it as quickly as somebody who's got a very strong immune system. And so it's going to kind of depend a little bit on if that person's, you know, healthy as a horse and gets flu and they're, you know, their fever is gone and they're feeling better a week later, I'd still give it some time. But in someone who, let's say, was going through chemotherapy and they got the flu and they were really sick for quite a while, I would extend that window out because it might take a bit longer for them to clear it. Someone asked about Novavax and if it's still available and if you recommend it. Same question here. So I heard that Novavax, I don't know if it's still available now. That's something I'd have to look into and I can answer later, because I do know, I remember seeing something about that Novavax was possibly not going to be marketing it as much anymore. So I actually don't know that question and can get back to you on it. Alrighty, so I think we're at time and it looks like I think I've gotten through most of the questions here. So thank you guys very much for your excellent questions and thank you guys for attending. And we'll be posting all the links in Mighty Networks shortly and also publicly as well for other folks. And that wraps it up for today. Thank you guys.